privilege of introducing my friend Carol Farver, who is our faculty for this session on emotional intelligence. So this morning we heard from people who are smarter than us speaking about if you want to know somebody interesting, chase them down. So I got to say, Carol, I chased Carol down several years ago. And I'm glad I did. I'm an emergency physician, and Carol's a lung pathologist, and you wouldn't think we have anything necessarily in common to talk about, but we actually do. So Carol, as many of you know, is the president-elect of our medical staff, starting in January. She's on the Board of Governors. Next year will serve on the Board of Trustees as well. She teaches at Cleveland Clinic Academy and Samson Leadership Academy in the medical school on emotional intelligence and leadership skills. So I know you're going to really enjoy this session. I know I will. And let's take it away. Thank you.
Great. So we'll tee up the slides here. Oh, there we go. I was going to say, I didn't know I had a white background. Thank you. This is great. This is a nice sized group. We're in here because they want to video it, so don't be overwhelmed by the size. I'm hoping to keep this very conversational. As Elaine said, I'm a lung pathologist, so I'm going to spend about an hour talking to you about emotional intelligence. You're going to be listening to a pathologist talk about emotional intelligence. That's the informed consent part of the talk. And I'm hopeful that Elaine will chime in as well, because she has many more credentials around talking about this than I do. And I hope that everybody here will chime in. So what we will do is we're going to talk first about what emotional intelligence is. This will be a basic primer. If you're here for a cognitive psychology talk, that won't be this one. And then we're going to talk very much about the self and systems competencies of the emotional intelligence model. It's a nice segue to what you just heard this morning, because our first talk was very self, the second talk was very systems. And I think this, in a somewhat concrete way, will try to meld those together in what can be a somewhat difficult term to unpack, leadership. One of the reasons that I became interested in this is that I had tried to do some leadership plans or leadership development, but unpacking that term leadership was difficult, and I didn't get how one could really take what one learned about it and make it much more actionable. So I think the emotional intelligence model is a really nice construct or paradigm where you can actually take this journey that will be clearly lifelong and put it into little buckets and start to work on it. That's the value I found about it. So we're going to review and begin to construct a leadership development plan for you. I've given you 2 handouts. We'll get to those when we start talking about leadership plans. The one is a somewhat abbreviated one, and as I'll mention at the end, I have a much more in-depth one available along with other material if you want to email me after this. I didn't want to kill a lot of trees. So we're going to get started, and again, we'll spend a little bit of time talking about emotional intelligence. What I want to do first off, though, is show you what I think is probably the most powerful example of an emotionally intelligent leader that I could find. I show this to the medical students, and some of them don't know who this is, so I like to show it. Everybody knows this is Robert Kennedy. And this was taken in 1968, and there's not a lot of gray hairs in this audience, so I will tell you, this was during what was a very tempestuous presidential campaign in 1968. This was Kennedy, who was scheduled to give a talk in Indianapolis, but the news had just come across the wire that Martin Luther King had been assassinated. So I won't show you the video because the video is kind of garbled and it's a little bit difficult to hear. But if you watch that video, you see people telling him, you can't go, you can't give that speech, we can't guarantee your safety. The State Patrol of Indiana said we're not going to be there. And Kennedy said, no, I have to go, I have to talk to them. So you see him traveling in the back of a car, scribbling on that envelope that he has in his hand, writing down these extemporaneous thoughts about what he's going to say. If you remember that campaign, it was full of anti-war sentiment. It was the peak of the civil rights. The country really was in a tumult. So they had every right to fear that this wasn't going to go well. So you see him get out of the car, run up, jump on this kind of makeshift wooden platform, and talk to a crowd of about 10,000 people, of which probably 50 to 60 were people of color who did not know this news yet. And this is his speech. If you want to run the audio.
Ladies and gentlemen, I'm only going to talk to you just for a minute or so this evening because I have some very sad news for all of you. Could you lower those signs, please? I have some very sad news for all of you, and I think sad news for all of our fellow citizens and people who love peace all over the world. And that is that Martin Luther King was shot and was killed tonight in Memphis, Tennessee. Martin Luther King dedicated his life to love and to justice between fellow human beings. He died in the cause of that effort. In this difficult day, in this difficult time for the United States, it's perhaps well to ask what kind of a nation we are and what direction we want to move in. For those of you who are black, considering the evidence evidently is that there were white people who were responsible, you can be filled with bitterness and with hatred and a desire for revenge. We can move in that direction as a country, in greater polarization, black people amongst blacks and white amongst whites, filled with hatred toward one another. Or we can make an effort, as Martin Luther King did, to understand and to comprehend and replace that violence, that stain of bloodshed that is spread across our land, with an effort to understand, compassion, and love. For those of you who are black and are tempted to be filled with hatred and mistrust of the injustice of such an act against all white people, I would only say that I can also feel in my own heart the same kind of feeling. I had a member of my family killed, but he was killed by a white man. But we have to make an effort in the United States. We have to make an effort to understand, to get beyond or go beyond these rather difficult times. My favorite poem, my favorite poet was Aeschylus, and he once wrote, "Even in our sleep, pain which cannot forget falls drop by drop upon the heart, until in our own despair, against our will, comes wisdom through the awful grace of God." What we need in the United States is not division. What we need in the United States is not hatred. What we need in the United States is not violence and lawlessness, but is love and wisdom and compassion toward one another, and a feeling of justice toward those who still suffer within our country, whether they be white or whether they be black. So I ask you tonight to return home, to say a prayer for the family Martin Luther King, yeah, it's true, but more importantly to say a prayer for our own country, which all of us love, a prayer for understanding and that compassion that of which I spoke. We can do well in this country. We will have difficult times. We've had difficult times in the past, but we will have difficult times in the future. It is not the end of violence. It is not the end of lawlessness, and it's not the end of disorder. But the vast majority of white people and the vast majority of black people in this country want to live together, want to improve the quality of our life, and want justice for all human beings that abide in our land. And dedicate ourselves to what the Greeks wrote so many years ago, to tame the savageness of man and make gentle the life of this world. Let us dedicate ourselves to that and say a prayer for our country and for our people. Thank you very much.
So for those of you who remember that night, just a reminder what happened in the country. There were really riots everywhere. South Central LA, Washington, New York, Chicago, Cleveland. Cleveland had a lot of riots as well. What happened in Indianapolis? People went home, got up the next morning, started making their lives better. So this is an example of kind of the power of a leader who understands his audience and what effect they can have on many things. I want you to take just a minute and reflect on this and write down a word. If you were asked to define an emotionally intelligent leader, write down words that come to mind. So let's hear some of these. Just shout them out. Calm, composed in any situation. Aware. A little more on that.
Aware, both self-aware and aware of those around
Right.
their state.
Right. And why was that so genuine from him?
I think because he had experienced suffering in his own life.
Right, right. You hear that throughout the speech, is that they get it. They get that he's gone through this. Any other words? Respectful. Respectful of others. What part of that speech did you especially think was respectful?
That he was acknowledging that they had a right to be outraged, and he made the effort to give them an alternate perspective and try to redirect maybe some of the negative thoughts in a different way.
He wasn't deflecting their genuine emotions. He knew this was painful and difficult, but pushed him beyond that. More. Fear and just? Fair and just. Right, a very high road. You know, when you think of the ways this could have been done, I mean, we were at kind of a tinderbox at that time, and it had to be handled just right. He had to have a high road, fair and just vision of where this had to go. Very positive, very optimistic. More words? Courageous.
You could have not given the speech at all.
I know. You often think of that, not only the physical danger, but, you know, nowadays, you know, they'd have 5, 6 handlers around you telling, oh, no, you can't do that. There's only a downside. You know, none of this is, we can't really do that. And yet, he had this self-confidence, self-awareness that he knew exactly what he needed to do. So he was courageous. Yeah. I know, you know, this speech is like considered one of the greatest speeches ever given, or whatever those lists on the internet you find. But, and you realize when you listen to it, and if you watch the video, it is completely him scribbling at the time. He hears the news, he knows he's got to go there, he's in the back of the car writing it. So he's extraordinarily concise and clear, and exactly connects with an audience that you know needs to hear that. Anything else? Compassionate. That you don't get a sense of anger, you don't get a sense of violence, rage, whatever. There is a composure and a compassion that he clearly has come to over time. I mean, his brother was killed 5 years ago, and if you've read about Robert Kennedy, it was a difficult struggle for him to get to a place where he even wanted to run for president, and felt very angry about what the country had done to him. So I think this amazing example of we're better than this, you know. Anything else? Adaptive, flexible, you know. I mean, nobody's prepared for something like this, but to be able to, again, on the spot decide this is what I need to do, to get up, to jump up on this kind of makeshift, you know, stage, and make sure that it was the right amount of time, said the right things. Even when you listen to this speech, you know, you hear the cheering and the inappropriate, you know, please put the signs down. He knew exactly how to handle the whole situation. Anything else? Yeah, so my hypothesis in showing people things like this is that you come to your own definition easily of emotional intelligence. And this just is a good example of, we all know what it is. You know, it's kind of Aunt Minnie. We know her when we see her. But let me show you the definition that I like to use of it, and just to give you some basics. So this is Peter Salovey's definition. We'll talk about Salovey in a little bit. And he calls it's the ability to monitor one's own and others' feelings and emotions, to discriminate among them, and to use this information to guide one's own thinking and action. It's exactly what you've said in many ways: empathy, compassion, understanding, flexibility. What is the crowd feeling? What am I feeling? Can I control it? Can I use it for a very positive, optimistic agenda? So when one talks about emotional intelligence, you have to kind of go back, because we've been in this world of talking about it for so long that you have to realize that this is something kind of new on the horizon. Most of the 20th century, when psychologists talked about intelligence, they talked about kind of your IQ. And how many here have taken an IQ test? Yeah, it's always interesting to ask. And in general, that measures your verbal IQ, maybe how much you comprehend, how quickly you can bring words to the front, your performance IQ, all these things that are really, really cognitive intelligence. And this idea that there was another intelligence was just not even mentioned. In 1937, a guy named Thorndike kind of shifted the axis of the earth a little bit by bringing up the point that there's more than this cognitive intelligence. People are successful in the world who may not be cognitively as talented as other people. There is something that he called a social intelligence. And people poo-pooed him and you never hear about it. And then in 1980, many of you have probably heard of this book, Howard Gardner's The Frames of the Mind, The Theory of Multiple Intelligences. Anybody do educational psychology? Most of the people who have read this book. And this was really the beginning of talking about social or emotional intelligence. And he brought up this idea that then continues to be worked on today, that emotions interact with thoughts and vice versa. And prior to that, there was this idea that if emotions did interact with cognitive thinking, they were bad. Don't get upset, you're not going to be able to do this and that. Now he brings up this idea that there is an interaction between them that is important to learn about, is beneficial or not, but there's a real kind of highway in the brain between them. And ask this question that we're still asking: how do mood states assist cognition and influence thought processes and personal judgment? From then on, the field kind of took off, mostly in the psychology world. Peter Salovey at that point was a professor in the Department of Psychology at Yale, and now is president of Yale University, and he has spent that entire time working on this same idea of emotional intelligence. In about the mid-1990s, Daniel Goldman, who's been at the clinic 3 or 4 times, has anybody heard him speak? Yeah, so Daniel Goldman's been here a while, and he is actually a journalist, but he realized that these competencies, this theory, was actually kind of an interesting construct for looking at business success and failure. So he took this and redefined it in a little bit of a messier way, and I say that only because if you start reading about emotional intelligence, you'll come into these little tiffs, more than tiffs, more academic arguments around what Goldman calls emotional intelligence and what Salovey and many of the academic psychologists call it. But be that as it may, what he did is he said there is an array of personal attributes that can make us very successful. And he looked at it specifically in the business paradigm. And I'm sure many of you have probably read his book. This is, you've made it when you are on the cover of Time magazine, but this was like in the late 1990s where it was really all the buzz. His book now is about in its 25th or 26th edition. So, and you can buy it, it's one of those airport books, buy it, you can read it on the plane, it's pretty quick. But he basically frames all of this in successes in the business world, metrics of making more money, building bigger businesses, succeeding as a CEO, et cetera. So that's how we more think of it now. The thing that he did, I think, that helped us talk about it, though, is he built this kind of 2x2 table. It took it out of what for me was somewhat of an uninterpretable kind of academic discussion to now this workable construct that I find really useful. And basically, he divided these competencies into a group of personal competencies and social competencies. Again, this is very much a lot of what we were talking about this morning. The self-competencies and the systems competencies. Those are things that anybody has to think about and start working on. So there's self-awareness and self-management in the personal competencies. And again, in the social competencies, there's social awareness and relationship management. Some people call those, organizational analysis and organizational development. So that's what we use a lot now when we start to kind of, again, unpack this definition of emotional intelligence. He then put, I think there are 18 different standards in each one of those competencies. And these are ones that one will hear about a lot. Your emotional self-awareness. You got up this morning and you were pretty tired. The last thing you wanted to do was come to a WPSA conference. You were aware that you were tired, so you were going to kind of get more coffee in you and kickstart your day a little harder. Accurate. Were you really tired, or were you depressed, or were you something else going on? How accurate are you in your self-assessment? Self-confidence. Again, self-management, the same thing. You woke up this morning and you were really mad, but you were able to control it. You came here and you were pleasant to people and managed to be collegial, etc. So this idea of self-management, transparency, adaptability, one of the terms that we talked about in the RFK speech. He was empathetic, transparent. I know what's going on here. He was adaptable. All those things that are self-management competencies that make for a productive life and a leader, good competencies in leaders. Then you walk outside, as Dr. Erickson talked about, is that a lot of this is living in an organization. A lot of this is living in society. And how do you adapt to those competencies? Do you understand who you work with? Or do you understand what kind of world this organization is? This organizational awareness idea of service orientation. Clearly, that was at the top of the list for somebody like RFK, that what you do is you want to do good. And again, you advance to this, I know, I understand this organization. Now, how can I lead it? How can I develop competencies so that I can help develop others? Can I be inspiring? Can I influence them? Can I deal with change? We hear a lot about that these days. How good are we at not only dealing with change ourselves, but dealing with change in the organization and even affecting it in a positive way? And then the inevitable conflict. No matter what happens, if there's change, there's conflict. And no matter if there's no change, there's conflict in an organization or a group or a family, whatever. And again, there's ideas of teamwork and collaboration. So this is the emotional intelligence construct that I think is pretty useful if one starts to focus down on how can I start to develop these career skills. So we think of this in the context of healthcare. I mean, this is used outside of healthcare, but to drill down a little bit more why Dr. Cosgrove brought Daniel Goldman back 3 or 4 times to what was quite a long session. Why is it important for healthcare to have emotionally intelligent people? Well, these are things that you could have thought of as well. I just put the ones that came off in the top of my head. We're now organized in teams more than ever. It will become more and more a team sport. It's important that we're good team players. Communication and, of course, listening is part of that to help in developing what will have to be creative solutions in what is a limited resource environment. And finally, we and our patients are increasingly coming from diverse backgrounds. We have to try to understand where everybody is coming from, so we can't live in our own little silos. I can't just sit in pathology and think that I'm going to know what's going on in the rest of the organization. When you look at these, and I'm not going to go into these studies, but I will say that I have a large bibliography that if you want to email me and you want to have some weekend reading, I'm happy to send you the bibliography that looks at the research in each one of these categories around which emotional intelligence can be important in healthcare. Better physicians, patient satisfaction. There are studies that show a more emotionally intelligent physician will have better satisfied patients. Physician satisfaction, physician resilience. There are studies that talk about and we heard again this morning, if one is more aware of their stresses, their emotions, their reactions, etc., they are more willing or able to cope with them. And finally, what I think is the holy grail of emotional intelligence in healthcare is this idea that we can actually make patients better. And in the last 2 years, there are these large studies coming out about looking at real healthcare metrics, diabetic control, admissions to hospitals, and comparing them to the EI of physicians. These are large epidemiological studies. Some of them are very compelling. They're pretty early. What's interesting and what I thought was so fascinating about Salovey is that Salovey was the first one to do these things. In fact, when I was a medical student, Peter Salovey had a study at Yale New Haven Hospital where he was looking at medication compliance in the AIDS population. This was in the late 80s. And by communicating in empathetic ways, he could show that he could improve compliance around medication. Now, if you want to Google or PubMed him, you will see that his lab has continued that effort in a lot of different really cool ways. How you message to your patients can make them more compliant, can make them healthier people. Improved getting pap smears, improved mammograms. He has one about dental flossing, eating vegetables, all this stuff. And again, it's not clear, and it's a messy literature, but there is this final, I think, as I say, a holy grail around that's what we do in healthcare, is that we want to find things that ultimately will make people healthier. So the literature on physician leaders and emotional intelligence is thin, to say the least. The literature on emotional intelligence and leaders in general is fairly robust. But again, people use different surveys, different inventories to measure outcomes, et cetera. So I like to do this every once in a while because I'm just curious to see how much people are really writing about physicians and healthcare and leadership. So I updated this, and this is the number of publications in PubMed that I can go through when I search emotional intelligence and leadership. And then I parse them out to the physicians, which are in the green, the nursing literature in the yellow, and then anything else in healthcare that talks about emotional intelligence and leadership. I always find this interesting, as you've already noticed, is that the nurses are clearly way ahead of the physicians in this and continue to be. And we know that. I mean, I'm a physician, I know that they think about this is important to their everyday life, and they write a lot about it. The physicians are kind of creeping up a little bit. You know, there are not that many publications every year. A couple of them always come from the Cleveland Clinic. And then you can see the total publications in general. So again, we're early in the game here. I say this just as to kind of qualify any of this, is that we don't know. It's not great research. Read it. And I don't like to present it a lot because I end up with a statistician in the back saying, but that's not the right p-value, and da-da-da-da. But I think it says that people are serious enough about thinking that it works. And we actually have some studies going here, again, looking at diabetic control based in our internal medicine residents, et cetera. So I think it's an interesting idea. This is one study that gets quoted a lot. It's old, 2006. And this was a study where they interviewed 10 chairs of internal medicine, and they said, without any type of prelude to the comments, what makes a successful chair and what makes them fail? And this is what they said. Again, this was uncoached. Emotional intelligence and its concomitant skills are the most essential competencies for leaders to succeed in academic institutions. The ability was fundamental to their success, and its absence the cause of their failures, and then suggested the absence of emotional intelligence often resulted in the demise of chairs and contributed to the high turnover among colleagues. So even in 2006, even in internal medicine chairs who probably don't read a lot of this literature, you can see their real world experience is, and we know these people, they have, you know, a lot of RO1s and stuff, but they just don't get the idea of how one has to lead people. So if we can, I don't know if we can turn the lights down a little bit. I like to show this picture because it's a pretty picture. It's a painting. People have probably seen this. Who's seen this? Yeah, so this is a painting called The Doctor, and it hangs in the Tate Britain, and it's actually just gorgeous. And I want to throw it out to you. Why do you think I show this? I'm talking about EI and leadership and healthcare. Why? What do you see in this painting? Anybody? Concern on the doctor? Father doctor.
Time spent, he's just sitting in a chair at the same level.
So he's thinking hard. You can see, if you look at the father, he has his hand on the shoulder of of the mother who's got her head down on the desk there. She's kind of just overwrought. Any other comments? So I show this because this was painted in London in the late 1800s at a time when child mortality was about 25%. So if your child got sick, there was a 1 in 4 chance that your child would not make it. And it was actually commissioned by Henry Tate of the Tate Modern and the Tate Britain for the artist who is the father. So Sir Lucas Feldy now was approached by Henry Tate, and Henry Tate said, look, you're a famous artist. I want you to paint a picture. And he didn't put any other constraints on it, so he got to paint whatever he wanted to paint. So Feldy's remembering this incident, remembering sitting and watching this doctor come to his home, hope above all hope, looking at him thinking, I hope he knows what's going on. I hope that he's going to make my child better. And the doctor, again, similarly, is going through that differential diagnosis in his mind of a febrile child. What is going on here? He knows, too, that this child is sick and might not make it. But he's also aware of the parents standing there, looking at him. They're not looking at their child. They're looking at that doctor, thinking, I have to show these parents that I'm doing everything I can possibly do to make their child better. So Feldy said, I want to paint about this because I want to celebrate the heroism of doctors. And I show this at this point because I think, even though I think doctors and healthcare workers in general don't get a lot of kudos for being emotionally intelligent, maybe, is that we really are. Our baseline is we do this every day. We live in an organization where this is really important. Many of you walk into patient rooms all the time with the parents or the grandparents or the children sitting there as you try to take care of that patient. And you too are going through your differential diagnosis, but you're also aware of how important this is for everybody standing in that room and how important that trust in you is. So I show it because there isn't a lot of research, but I kind of think we're good at it. I think we probably do this really, really quite well. Nonetheless, can we teach it? That's always the question, is can we really teach emotional intelligence? And I don't know if anybody saw this. This was from the New York Sunday Times about, I would say March or April or something, where Mark Brackett, who now runs Peter Salavy's lab at Yale, has an interesting curriculum where he teaches emotional intelligence in junior high. And I like to show it because I just like this idea we're teaching junior high kids about emotional intelligence. What a better place to start. And I went down to the Union Club or whatever those places are downtown and heard him speak. And he has this fascinating program, which now is in Shaker Heights. It's called The Ruler. It stands for Recognize, Understand, Label, Express, and Regret. And he simply goes, and he's gone into the Shaker Heights Junior High, and he's gone to a number of different places, both inside the country and internationally, where he presents this program where kids are told to start to monitor their emotions. They come in at school in the morning and they pick a color. If you're cold, if you're red, you're hot and you're angry and you're going to tell people about it. If you're blue, you're like angry but you're not going to say anything. If you're yellow, you're really happy and you want to tell everybody about it. And if you're green, you're really happy but you're fine not saying anything. So they have a whole color chart as an expression, as a scale of what their emotions are every day. In addition, he gives them words. So you have junior high kids' vocabulary words, practicing the expression of their emotions. So they go home and sit at the dinner table and their parents say, well, what'd you do today? And how was your day? And the junior high kid will go, today I was really morose. And they're kind of like, my, that's quite a big word. And so he's teaching vocabulary, again, this idea of understanding, expressing, and then regulating. And he has data, which again, I won't show you, but it's quite compelling data that this has decreased the amount of bullying, decreased the amount of playground violence, etc. Also has increased the cognitive verbal expression in some of these. So it's an interesting, we can teach it when it's actually very broken down, unpacketed into what these skills really are. So inspired to kind of unpack this construct, I put together what is kind of a curriculum, and Beth knows about this curriculum, where I teach it to the chief residents. I've teed it up to the medical students. They're less interested in it. But this is kind of how one can put together in your own life, what things can you do when you walk out the door today to actually improve your emotional intelligence. And there are things that are available around the clinic. You know, with my chief residents, I do a 2-minute autobiography. It's really important when you listen to 2-minute autobiographies because they tell you exactly what they think is important in their life. There's been a lot going on, but they select for what they see themselves as. Similarly, if you write your own autobiography, Elaine and I have done the master's at the Weatherhead, and the first thing you do is you write your own autobiography. And it's really interesting when you have other people read your own autobiography because they point out what you've selected to talk about. Who are you? Who do you see yourself as? And then a lot of inventories, Myers-Briggs, learning styles. Anybody here take a learning style? Yeah. How about a Myers-Briggs? Yeah, so a lot of people have done the Myers-Briggs. The learning styles, again, is another really important tool that I've found is how do I learn best? And we'll get back to that in a bit. And then write in your journal. We'll talk about journaling in a bit. And then read your own journals. I mean, the ability of self-deception cannot be overstated. If you journal and then you see how things happened, then I think the data is there. Again, self-management, we do time management, we do the wellness. We talked a little bit about this morning, developing mentor networks. And then the social awareness and relationship management. We talk about systems thinking. You know, this is a big organization with a lot of tentacles. Whatever happens somewhere usually feeds back somewhere else. So systems thinking, cultural competency or diversity, we give a talk, organizational culture, this idea that every organization actually has its own culture. You know, the medical students many times don't get this concept because they think, well, every hospital is going to look like the Cleveland Clinic. And then the chief residents get it a lot because many of them have come from other medical schools or other places. And there's definitely a different culture in this place versus other places, et cetera. And then again, strategy, and then the relationship management, which is, I think, when one thinks about leadership development, one is always really looking at that lower right-hand quadrant. You know, how can I improve systems? How can I improve processes? How can I handle change? How can I do conflict management? All this is kind of the leadership competencies when we think about people being good leaders. But what I want to say is that it's all built on a foundation of having to know all of this, or else you can't really get to that. It was interesting because when I started talking about this two different levels of physician training, I found that, in fact, you know, there was very definite likes and dislikes, or interests and not interests. It's kind of these kind of, you know, Erik Erikson's developmental stages. Some of them, they're just not ready to listen to it. So the medical students were, as you can imagine, very much into the self-awareness, self-management. Great time managers, you know, running marathons, making sure that, you know, everything gets done. They had no interest on the lower part of that. The residents, especially the chief residents, have kind of got those self-awareness, self-management skills down. And they are now starting to be aware of this organization as chief residents or now have to lead parts of this organization. So they become much more aware. And then finally, I think we would say as faculty, fellows, mature leaders of this place, we are much more in that lower quadrant, lower two quadrants most of the time. What I'll tell you, and Elaine told me this story, is that people who talk about emotional intelligence say that the most important quadrants are those self-awareness and self-management quadrants. That, as Annie McKee said, you know, all this emotional intelligence, Annie McKee is kind of a EI guru that writes a lot of books, et cetera. And You know, all this emotional intelligence is fine, she says, until you get really pissed off. And then it just, you know, this isn't helping me. And what she means is that those first two quadrants are really the key to success in anything.